Hello, everyone. Greetings. So excited to welcome you to our October 2024 session of Community Health Learning Collective, or CHLC. My name is Maureen Burns, and I am one of the co-facilitators of this group. My colleague Candace is out at APHA, I believe, so I don't think she will be joining today. But we're thrilled to have you all here with us for October session. For those of y'all who may be new, Community Health Learning Collective is basically designed to be a shared collective learning space, focused primarily on community health workers, promotoras de salud, CHRs, but also our allies, those who work alongside us, adjacent to us, support us. Basically, if you care about the health of the community and you respect the work of CHWs, you are welcome here. So we are really, really excited to always share space with you every month. This month in October, we're thrilled to welcome Anita Roach of FAIR. And I'm going to tell you just a little bit about Anita and FAIR. So Anita is the VP of Health Equity and Community Engagement at FAIR, which stands for Food Allergy Research and Education. Anita supports FAIR's efforts to understand unmet needs at the neighborhood level, provide community-powered food allergy education, awareness, and support, and create pathways for improved representation in research and care. And so today, Anita is going to be speaking to us not only about food allergies, but about disparities and the important role that each of us as community health workers can play in addressing those disparities. So with that, I'm going to hand it over to Anita. I'm also going to remind everyone, please feel free to put questions and comments in the chat. And then after the presentation, we'll have some time for verbal Q&A as well. So welcome, Anita. We're thrilled to have you, and please take it away.
Thank you so much, Maureen. And thank you to everyone for joining us for this presentation. I'm really excited to not only share more about food allergy with you, but also about our initiative and the important role that community health workers play in it. And myself, I'm a proud ally of the community health worker community. And as this is a collaborative learning hub, I'm really looking forward to not only telling you about food allergies, but really learning from you. So as Maureen said, please feel free to add comments, questions to the chat. There we go. None of this work that I'm going to describe, I do alone at FAIR, Food Allergy Research and Education. Not only do I have an incredible team listed on this screen, Marie Malloy, Elizabeth Bradford, and Amber Arias, many of them are in the chat on this call today, but also a team of community health workers, and I'll go into those details shortly, as well as incredible partners. And so Mobile Care Chicago, one of our Illinois partners, introduced us to the HAP Foundation. And so really pleased to be connected through Mobile Care Chicago. And I see a number of our partners on the call, like Northwestern University, CFAR, and other groups. So I'm happy that this is a team effort, truly. So we usually use Teams, so hopefully this works in Zoom, but would love to see a show of hands, thumbs up, if you have a food allergy or live with someone with a food allergy. Wow. Either I'm doing this wrong in Zoom or not too many on this call. But what I can definitely assure you is that there are many people within the communities that you serve and care so much about facing food allergies. Across the US, it's about 1 in 10 adults. For children, it's about 1 in 13 children, or 2 in every classroom. I know that oftentimes people will think about food allergy as a childhood disease, but actually more and more adults are developing food allergy, and adult onset food allergy is growing at a rapid rate. And to that point, about half of adults with food allergies have had a severe reaction. Typically, severe reactions may include having to go to the hospital. We'll dive more into what that means shortly. And about 4 in every 10 children have had a serious reaction. And not only is it the reaction or avoidance of food that burdens people with food allergy and their families, but it's also the fear of having that severe allergic reaction or what we call anaphylaxis. And that fear is not only shared by the patient, but also the caregiver, the family, the other folks in the household. So this is truly a disease where it really takes a village to care for and keep people with the disease safe. So what is a food allergy? So a food allergy is when your body's immune system or the system that keeps you healthy actually has a reaction to the food. And what we call that reaction is an allergic reaction. As I mentioned, food allergies can start at any age. We have more and more insights on how to prevent food allergies, especially when they develop as they develop earlier on. And so an important component of our work and the work of many of our partners on the call is to make sure that awareness of prevention spreads everywhere so everyone has a chance to reduce the risk of food allergies. But again, it can start at any age, and food allergy reactions can be deadly. So while not frequent that end result, it can happen. And again, the fear of that happen can really be burdensome to families. Food allergy is not an intolerance or sensitivity. So there are certain reactions that happen that are not based on certain chemicals within your immune system called IgE. And these reactions could be, for instance, a gluten intolerance or lactose intolerance. And while they can make you feel not great at all, they don't have that life-threatening component that food allergy reactions can have. So the top 9 allergens in the US, or the foods that are most likely to cause a food allergy reaction, include eggs, fish, milk, peanuts, sesame, shellfish, soy, tree nuts, and wheat. And sometimes we, as a society, have a misconception that one allergen is worse than the other, like maybe peanut allergy is worse than sesame or shellfish, but any of these allergens, if you're allergic to them, can cause a life-threatening reaction. Severity doesn't depend on the allergen itself. So how do we avoid reactions? So currently the gold standard or the primary treatment for food allergy is avoiding the allergen, avoiding the food that you're allergic to. So really core to doing this is understanding reading labels, reading a label every time you buy the item, because sometimes labels can change even with the same item. Making sure that you prepare and store food safely, avoiding mixing of allergens that you may be allergic to, and then being careful when you're eating out and traveling. So as you all know, food is very cultural. Food is how we oftentimes share good memories, or in some cases, bad memories, or, really how we connect with each other. And so it really, again, it takes many people to keep someone with food allergies safe when you're thinking about who you may read labels for, who you shop for, who you prepare foods for. So sometimes I mentioned cross contact and how you store and prepare food. So there's a difference between cross contact and cross contamination. You may have heard of cross contamination. That's when germs or bugs get in your food. It can make you sick. That's cross contamination. But with food allergy and cross contact, that's when a food that you're allergic to or someone's allergic to gets in contact or touches a food that you think is safe. And even though you may not directly eat the allergen, like you're not eating that bowl of shrimp fried rice, for instance, because your rice was cooked in the same dish or cookware as the shrimp, if you're allergic to it, it can cause a reaction. So that is sharing utensils that may have your allergen contact or allergen on it. That might be just removing the shrimp from the salad or the dish if you're allergic to it, even if you're not eating the whole piece of shrimp, can cause reactions. Other sources of cross contact, unclean dishes, not washing hands properly, again, storing food, and then that direct contact. How do we prevent this? As you can imagine, is really washing your hands with soap and warm water before you touch the allergen or something that might have the allergen in it. And then it's scrubbing the counters and making sure that that gets washed, soapy water, warm water before and after you cook. Not relying on sanitizer gel or just water. You really need the bubble reaction, the bubble action to get rid of the allergen. And of course, not sharing food, drinks, or silverware that may have the allergen on it. I mentioned reading labels, and we actually, a few years ago, about 5 years ago now, did a study with the Center for Food Allergy, Asthma, and Research. That's a part of Northwestern University, our partners in food allergy research and education. We did a study, and many people within our food allergy community, the 33 million Americans with food allergy, have trouble reading labels. Sometimes they can just be long, not so clear. But the good news is that for the top 9 allergens, it is regulated by the FDA that they must clearly state that those top 9 allergens are in the food. There are labels, what we call precautionary allergen labels. You may have seen it as may contain peanut, processed in a facility with tree nuts. That is not regulated by the FDA. And so for some people, if they're allergic to peanut and it says may contain peanut, sometimes we have reports of people having reactions. And so whether or not you can eat a food that has may contain or precautionary allergen label for that allergen is really a conversation that needs to happen with you, the family, and the doctor to determine your risk. I don't know if you've ever seen an allergic reaction, but it can be quite scary. It can affect the skin, the stomach. It can affect how someone breathes, their heart rate. Symptoms can appear within minutes of eating, which is most common, but it can also happen up to several hours after the allergen is eaten. Symptoms can be different for each reaction. They can look different in different skin types or skin tones. And so it's really important to know what food allergy reactions look like in people who look like you. And then the reactions can range from mild to severe. And just because I had a mild reaction before does not mean the next time it'll be mild again. It could be mild, it could be more severe. It's pretty unpredictable. And these severe reactions are called anaphylaxis. Again, they can look a little different in each person, but the good news is that with immediate use of a medicine called epinephrine, you can really mitigate or reduce the symptoms of anaphylaxis and reverse it quite quickly. But the important note there is early and quick. They say, you may have heard epi fast, epi first, epi fast. And so that means that if you suspect that you're having an allergic reaction, that someone that you're with may be having an allergic reaction, if they can get epinephrine quickly, the symptoms can start to resolve, and you really have to give it right away. And now we have several options of how to deliver that epinephrine, both auto injector. You won't see syringe needle as much, but definitely auto injector. And now there is a nasal spray. So we have more and more options, which is exciting. Again, here are some of the allergic reaction symptoms. One thing I do want to note is that in some of our younger kiddos, it may be hard for them to explain that they're having a reaction. And so some things that we've heard before are, my tongue feels spicy or weird or itchy. You really have to kind of get a sense, and you can do that both with working with a healthcare provider, but also community health workers. We have trainings and resources that can really help community health workers bring awareness to the signs and symptoms of severe allergic reaction, regardless of age. So I would say it both takes kind of that education and community education to keep people safe with food allergies, and then really being able to be aware of these signs and symptoms listed on the screen. We do have it. So under the emotional box, sometimes we call it impending doom. Like you kind of just feel like something really bad is happening. And so the emotional component of an allergic reaction is important too, just like the more physical symptoms you can see. Okay, so the steps, we went over this, but it's so important to reiterate. Give epinephrine fast, give it first. Different antihistamines like Benadryl will not stop a severe allergic reaction. They work on different parts of the immune system, different than epinephrine. And we oftentimes here in working with community members, everyday folks, I'll give a Benadryl and then I'll kind of wait for symptoms to go away. I have people in my own, I can assure you, I have people in my own family who have had that sentiment, and I totally get it, especially because the access to to Benadryl or other over-the-counter medications may seem easier, but in the case of severe allergic reaction, that Benadryl won't work. So we really give epinephrine um, at first signs of symptoms. Call 911. If symptoms do not get better, you can give another dose of epinephrine. So every epinephrine device delivery system will come in a twin pack, whether it is the older versions of the auto-injector or the newer versions of the auto-injector or the nasal spray. They all come in twos, primarily because of that second phase of reaction that could occur, or because mistakes happen in giving the epinephrine, or because in some cases the patient just will need 2 doses. So they always come in twos. And then it is important to go to the hospital, even if the patient feels better. As I mentioned, it's not just the accidental exposure or accidentally eating the allergen that can be a burden on people with food allergy. It can be that social emotional component of worrying about ingesting the allergen. We eat hopefully at least 3 times a day. So there is that constant sometimes worry. And then you have to tell others to keep yourself safe. So this is really a disease that takes a community. And it's important for people with food allergy to not only learn how to read labels, learn how to avoid their allergen, but in some cases get help for managing some anxiety or stress that may come along with managing food allergy. With that, I'm going to turn over to talk more about the disparities, because it really builds on everything we've talked about thus far. Maureen, are there questions now, or should I keep on going to the second part?
No questions yet, just some
Okay.
comments.
Okay, perfect. So as you can imagine, most of you are either community health workers or allies of the community. So you know that oftentimes in Black, Latino, Latinx, and our BIPOC communities, diseases have even more of a burden in our communities. And that is the same case with food allergies. What we see from the research from our partners in Chicago and other locations, Black children oftentimes have a higher risk of developing food allergies, especially compared to non-white or non-Hispanic white children. Just like with other disease areas, with other specialty areas, it's harder to get that referral to an allergist, which is the doctor that primarily manages and treats food allergy. Much harder to get that allergist referral. And then if you are lower income, if you are on Medicaid, there are much fewer Medicaid accepting allergists in this country compared to allergists that don't accept Medicaid. So, sorry, there are many allergists that don't accept Medicaid. So that can be another burden. And then it can make it longer to follow up with an allergist. And then if you're living in a place that may be a food swamp or facing food apartheid, it can be even harder to avoid the foods that you need to avoid to not have an allergic reaction. The cost of medication, like many disease areas, can be a burden. And then when it comes to managing food allergies in school, we know that overall school can be a tough place sometimes to get those health management plans, like a 504 plans in place without the proper awareness and education and resources on the topic, which we do have, and we do empower community health workers with those resources to give back to the community. But with all of that being said, and everything that I described with food allergies, what we do at FAIR Food Allergy Research and Education is really to make sure that we can support the community and collaborate with partners so that we reduce some of that fear that people may face that have food allergies, and really provide information, evidence-based information and support and resources to make living with food allergies much easier. And this is where our initiative, our Fair Neighborhoods initiative, comes into play at FAIR. So we've built an initiative that really is based on a social ecological model framework, where we are going to every tier of society to provide partnership, support, and collaboration to better uplift the food allergic community. It really starts with meeting the community, the individual within communities where they are. I never think about it like someone thinks Benadryl is the first line. How could they? I understand it can be easier to get those, or feel easier to get those antihistamines. So how do we, one, make it easier for this individual to get the right medication they need? And then two, make sure that they know when and how to use a medication like epinephrine. So it's a no judgment zone where we are meeting people where they are to provide them with the education and resources needed, and with the resources that are oftentimes not as attainable or accessible just because of where you work, live, and play. And that's where community support comes into play. We have a network of support group leaders around the country that really, on a day-to-day basis, are that kind of bridge to FAIR and bridge to resources for the everyday community members. And on top of that, our community health workers are really the pinnacle when it comes to identifying which community members could use the most support and how to deliver that support to them. So I want to take this moment to thank you all for, whether it's on food allergies or so many other diseases that we're facing, or just everyday life issues that we're facing. Thank you for meeting the community where they are. I love the Zoom hearts. Thank you. Institutional level, I mentioned at the upfront of this conversation, I'm here and so thankful to be here talking to you all about food allergy today because of a partnership that we have with Mobile Care Chicago. And so partnership and collaboration at the organizational level, how do we do that to really make the most impact? We've built that into our Fair Neighborhoods initiative, because not only can no partner, one organization do everything alone, we can't, no one can, and no one should. And so we always look for the right partners and mutually beneficial relationships to help really meet the community and individuals where they are. And then, of course, without policy change and public engagement, we won't really move the needle. And so we have a whole arm at FAIR advocacy team that is working every day, both at the federal, but especially at the state level, to introduce legislation, to pass legislation that'll make it easier to prevent food allergies from the onset, getting babies what they need to hopefully reduce the risk of food allergies, or making epinephrine caps in place and making it more affordable to buy epinephrine, or working at the state level to address restaurant laws and restaurant bills to make sure that restaurants are getting the proper food allergy training needed. We really work at that level to make change society-wide. Our Fair Neighborhoods initiative is currently in 6 locations across the country and growing. So proud of our Chicago Fair Neighborhoods initiative. And we're also in the South Ward of Newark, New Jersey, Southeast DC, the southeastern part of Virginia or Hampton Roads, Virginia, Central Arkansas, and Atlanta, Georgia. And what I can say is while every community has many of the same burdens or barriers, how we go about supporting and partnering with the community to address those burdens and barriers look different in each community. And that's expected, and that's what we really like. So what programs or initiatives that may really work in Newark may not work as well in Chicago, for instance. And the only way we know that is by building community councils to help us have a community-informed approach to our work, doing needs assessments to really understand the need, and then again, validating those needs back with our community health workers who, which, keep really their thumb on the pulse of what the community is facing every day. A lot of our work involves education and training, building navigation and access bridges, facilitating food access. We're kicking off 2 pretty big pilots in Central Arkansas and Newark to address that, but would love to do that in each location. And then conducting community-based participatory research, again, to understand the needs and then deliver that data back to the community and work with the community to address what we're finding collectively. And this is my favorite slide in this whole presentation because these amazing people have really turned our program into a full-blown initiative. And just over the past year, our community health workers, Victoria Enciso, Ashley Goins, Alvinette Grimes, Janet Mateo, Sharice Wilson, and Clenita Wilson. They are in all of 6 of our locations. We have 1 community health worker in each location. They are working about 25 to 30 hours a month, some months a little bit more. Our busier months like October and Halloween and back to school season and a few others, definitely there are more efforts going on locally. But just in the past year, they have reached now over 6,000 individuals across the 6 communities to provide direct one-on-one training. So not just giving a link to a website, but talking about food allergy, listening to the community, and then bringing that back to us so that we can build the tools and resources with them that could help address the community needs. We also do a lot of work with schools. We recently sent a really cool, I don't know if Marie's on the call, but my teammate Marie Malloy and our comms team created this calendar based on the feedback we were getting from the community health workers and from the schools, saying that they would love a day-to-day reminder of how to keep their community, their students safe with food allergy. And now we have this really neat resource based on the school calendar year to help just keep food allergies top of mind. And so we really listen and then we work to create the resources needed. And again, I mentioned Mobile Care Chicago. They have 2 or I think maybe more at this point, vans that are in Southside Chicago and beyond Chicago area, providing that allergy care to the community, as I mentioned, can be really difficult to get to an allergist and get the care needed, but they're meeting kids outside of the school in their neighborhoods where they live to make it easier and really be that trusted regular point person within the community. And a picture says 1,000 words. I just wanted to share a couple of pictures from some of our engagements. Again, many of the engagements that the community health workers and my staff lead are not solely for people with food allergy because it takes a community to keep people with food allergy safe, but we're doing hands-on work with allergy-friendly foods, safe foods, fact or fiction trivia games, really making it engaging for all to learn about food allergies. And there's Vicky in this middle picture. And one more thing I wanted to cover is some of how we're assessing what's working and what's not in the Fair Neighborhoods initiative. And so not only do we do post-event surveys with every event that we do, we take feedback and advice from our community health workers and community advisory council members. We also, it's been biannually or every 2 years. I think we'll do another one next year. We do needs assessment surveys to get a broader awareness of the food allergy needs in each community. The typical needs assessment cycle where you gather the evidence, analyze, you brainstorm with your collaborative about how we can, what are the contributing factors and how can we get to the root cause? And then we take all of that and build programming based on it. So here's just a little sample of what's working. So in 2021, in our first Fair Neighborhoods of Newark, New Jersey, we did a survey, 726 community members with food allergy in Newark. And we then did the survey again in 2024. And it was a smaller population, a smaller cohort of that same group. But this was a cohort that was really continuing to be engaged with the program and had access to all of the resources and programming that we did over the past 2+ years at that point. And what we saw was that the annual visits with an allergist, like many specialty doctors, is recommended to see that doctor about once every 12 months, that those annual visits have gone up by 25 percentage points from 2021. We also did the survey in Newark this year with the community members who have not been part of the Fair Neighborhoods Initiative, but have food allergy, and it's gone up even higher. So there are the Fair Neighborhoods participants, even more of them are seeing an allergist compared to their neighbors that are not a part of the initiative. And then similarly, more people are having an epinephrine prescription. That's gone up by 38 percentage points. We're seeing that more people in this initial Fair Neighborhoods location have more consistent and quick access to epinephrine. Again, I mentioned epi first, epi fast. If you don't have the epinephrine when you're having a serious reaction, it can really lead to worse outcomes. And so we're happy to see that it's gone up by 5%, the number of people that have that quick access. And of course, we're looking to grow that. And one area that we're seeing is kind of trending the opposite way is on food access, and specifically access to allergy-safe foods. And so, of course, when you know more about different options, different alternative substitutions, you're going to have that greater awareness that you may not have that access. So now what we're looking to do is not only provide more education on what those substitutions or options are when you have food allergy to keep yourself safe, but we're looking at and we're launching pilot programs to make it more obtainable, to actually get access to those safe foods for free. And we're looking to do that in order to ultimately, as I mentioned, change the policy landscape so that with food allergies, food is medicine, and all of those policies that are happening for diabetes and other disease areas can become an actuality with food allergies. I would love to learn more from you and also to be able to provide you with more free resources on how to keep your food allergic community safe. We have a free community health worker training online called the Food Allergy Exchange. It is on our website, foodallergyacademy.org. I will pop a link in the chat. It takes just a couple of hours. There are 2 phases of the program. Phase 1, a couple of hours, where it breaks down much of what I described, but in more detail about reading labels, more policy details. But then there's a second phase of it where you get hands-on training virtually in a live class that can be done separately to really strengthen your ability to train the community or teach the community about food allergies. And it's all free. And many other resources are available on that website as well. All right. Thank you again. I'm going to stop sharing so I can see Maureen and everyone. But yeah, I'm happy to answer any questions. Oh, Vicky's on. Hi, Vicky.
Sorry, running around.
No, it's okay.
Okay, so running around. Maureen, you made a comment on the first comment that you made. What was your comment on? You said intolerance is
I was making a comment that I really liked. First of all, thank you, Anita. I really liked that you stressed the difference between intolerance to something not being the same as an allergy. Because sometimes I think it gets a little jumbled or mixed together, and I'm not by any means dismissing people who have intolerance. Like, it can be very uncomfortable and you have to watch what you eat, but like having an intolerance to gluten or lactose is not the same as having an allergy to peanuts, right? Because you won't have anaphylaxis as a potential outcome. So I was just kind of emphasizing that in the chat.
Thanks.
I also wanted to ask, and while I'm asking, if anyone else has questions, feel free to put it in the chat or also raise your hand. I wanted to ask about EpiPens, and if there's anything in the works to maybe adjust the way access is provided. So before I became a community health worker, I used to work in a pharmacy. And so we would see a lot of times people filling their prescription for their EpiPen, and all that goes into getting an insurance company to pay for it, day supply and all of that. And it kind of, with the potential serious impacts of someone having a allergic reaction, including death. I'm kind of thinking about like naloxone, where like now a lot of places you don't need a prescription. We can all just carry naloxone. If someone ODs, we have it. Anything like that in the works for EpiPen?
I think so, actually. So a couple of things. And it's a great question and a great point. So we are working at the state level to cap the prices of epinephrine pens or epinephrine auto injectors. And so there are several states where there are caps at $60 for that twin pack. So that's one. Two, the newer device, as I mentioned, the nasal epinephrine Neffy device, is actually the same device as the naloxone device. And so now it looks exactly the same, a little bit different coloring, but same manufacturer, same device. So we may have even better of a chance, Maureen, to get epinephrine to the place of naloxone where it's much easier to access. Everyone can carry it. Everyone can carry epinephrine auto-injectors as well. There's a little bit of training that people should get or need to get in order to know how to use it. But yes, we have a clearer path to easier, more widespread access to epinephrine because of the new products that are coming to market in epinephrine. And then let's see, especially for some of the newer products, there are patient assistance programs where if you, depending on what kind of insurance you have, it could be about $25 a pack for the twin pack. And then for those who have a high deductible, more $199. So it's not super cheap, but we are pushing to really make epinephrine more affordable and accessible, to your point of everyone should carry it to keep the community safe.
Well, that's exciting to hear. Thank you. Anyone else have questions or comments for Anita?
I know that I came a little bit late. Anita, did you let them know that the studies, not the studies, the classes that FAIR offers are free to, some are free?
Yes, that's a great point, Vicky. So the FACS training is free, and I think Marie, one of the FAIR staffers, popped the link in the chat. But basically, monthly, sometimes twice a month, in addition to the on-demand trainings we have free webinars on topics from everything from back to school and how to get 504 plans in place at school to Thanksgiving's coming up and how do we make sure Thanksgiving is inclusive and safe for everyone. We do webinars for teens or young adults on dating and kissing and how do you live as a young adult with food allergy? As I mentioned, more and more adults are having food allergies. Kids are growing up with food allergies. So that kind of real world experience with food allergy, all of it's free. All of it is super accessible and engaging. And I popped my email in the chat. Vicky is also another great resource. And so we would be happy to share all of our resources for free.
Thank you so much, Vicky and Anita. I also just wanted to kind of, I guess, lift up something that you said in the presentation about it taking a village, right? Which I think is so important because you think about people have really severe food allergies, and how that impacts like the school. Many schools have gone like nut free, but also how sometimes, parents or students who don't have that lived experience with a food allergy might not understand the why behind that, right? Or might be dismissive of people's experiences. So I think that was really cool how you kept emphasizing that, like, yes, a lot of people have food allergies, but even if we don't, we have a role to play, right? Collectively keeping one another safe. I also see a question from Deborah in the chat. How do adult onset allergies develop? Is it environmental or hormonal or something else?
Another great question. So we don't know exactly. There are many kind of theories, ideas around the why, but what some of the most popular or the common thinking around it based on the science, one factor could be environmental. So we know that a lot of the environmental allergens that, especially sometimes depending on where you live, um, sometimes what allergens may exist in the household or in the community can lead to food allergies down the line. And so we're seeing more of that. There, we know more about why food allergies are developing kind of in childhood or that earlier onset of food allergy. There are some theories around, again, making sure that the allergen or the food gets introduced to the body through the mouth, through eating diverse diets, eating these diverse foods early and often. But there's still a mystery around adult onset food allergy. And so I would say knowing about food allergy is really the most important piece of this, because then you can recognize if you're having some symptoms. It may not be full-blown anaphylaxis. To Maureen's point, it may not be an IgE or the food allergy that we described in today's presentation. But that's why it's really good to have these conversations with your doctor, with an allergist, because they can really rule out if something's a true allergy or if it's not. And one of the things, in addition to that confusion sometimes between food allergy and food intolerances that we see, is that people are thinking that they have many allergies to many different foods and are avoiding foods that they don't need to. And so again, that's why having that good relationship with a pediatrician or an allergist can help rule out what you have and what you don't have as it relates to food, regardless of your age.
Deborah also put in the chat that she's had clients who have gone through chemo and radiation and say that all of a sudden they have shellfish allergies. I also kind of want to piggyback off that and just mention that, like, I think this also sometimes impacts treatment. Like, I remember with my dad, when he was ill, he had an allergy to shellfish, and there were like certain procedures that he could not have because the contrast in the procedures had like ingredients that were shellfish based.
That is such an important point. And actually, FAIR is with our partners and with advocates, we're working on legislation called Adina's Act. And so Adina is a young girl from Wisconsin who, during her time at summer camp, was given a medication that contained her allergen in it, but wasn't labeled. And she had anaphylaxis from the medication. And so we don't have those clear labeling laws that I described for food, for medicines. And that's legislation that we're trying to push so that whether it's food or it is a medication that you're taking or treatment, a dye that you're taking for a procedure, you can also know whether or not your allergies are in it, because you don't want to be in the hospital for one reason and then end up having anaphylaxis. So very important point and legislation that we're working on. And to that point, Deborah, actually shellfish allergies are the most common allergy for adult onset, or a food allergy that's developing in adults. And there's a lot of crossover between environmental allergens and shellfish. So I'm sorry to hear that. And that's really common, what you're seeing in your clients. Mhm. There is. Yes, Deborah, I see your comment about restaurants and information there. And so one of the resources we have, again, we can provide this for free as well to restaurants, especially restaurants that are in our fair neighborhoods, is Fair Check. So our Fair Check training is accredited training that can be done across the food service professional spectra. So whether it's K through 12, which is free, or whether it's for restaurants, food pantries, soup kitchens, we have online training to help prepare all food service workers on how to keep people with food allergies safe. And there are a couple of states where the training is mandated, because unfortunately, a lot of the training that is available for food service workers as it relates to food allergy are really outdated. And so our training, our Fair Check training, is updated, um, easy to take, easy to understand. And we can do this as a service of Fair Neighborhoods Initiative. We can provide Fair Check training kind of on demand or live. So we can do it virtually. We can always determine if we can do it in person as well, so that that is not a barrier to keeping your community safe.
That's really wonderful to hear. Does anyone else have a question? You can put it in the chat. You can also feel free to come off mute and share out loud. All right. Well, I want to thank Anita so much for being here, and really all the folks from FAIR, the Vicky and the other community health workers doing this important work every day. We really, really appreciate the work that you're doing, and also the resources that you've created, not only being here today to speak to us, but the free education that you have for CHWs. So I will definitely be sending out a follow-up email with this recorded session, with slides, with the link to that free training, so that hopefully people can take advantage of it. I also want to just give a quick reminder that our final CHLC of the year, November session, will take place on November 20th, 2024 at 12 p.m. Central Time. And that will feature speakers from the Southeast Community Health Worker Network. They will be talking about the importance of regional representation and certification reciprocity across states. So that promises to be a great conversation. For those of you who don't know, we typically skip December here at CHLC, so we will not have a December session. So that's why November will be the last session of the year. So we hope you all can make it. And then lastly, please make sure to email me. I believe everyone has my email address by now. Email me if you have events or announcements or things that you would like to share. If you can get that to me in the next couple of days, I'll include it all in the follow-up email. So once again, thank you so much, Anita. And everyone have a wonderful day.
Thank you. Thank you, everyone. Bye.